The future of therapeutics in ovarian cancer is likely going to incorporate combinatorial approaches. We believe that with single agent PARP inhibition, we've been very successful in the BRCA mutated population with exciting signals, mostly hypothesis generating because they were not hypothesis tested in the HRD patient population. But the question is, how are we going to continue to advance our therapeutic efficacy in patients who may not be biomarker positive here, the BRCA wild type patients, the homologous recombination proficient patients, and that may be with combinatorial approaches. Most recently, in the 2020 SGO meeting with abstracts that were released virtually, there were some interesting preliminary results that were reviewed. The OVARIO trial was a single-arm phase 2 study that looked at the combination of bevacizumab plus niraparib. Again, really focused on the safety data output, which is what was released. The 6-month progression-free survival rate in this patient population was essentially 89%, which is what we would anticipate because, again, these patients are selected on platinum sensitivity prior to transition onto niraparib plus bevacizumab. So this is a well-behaving patient population, although, again, the 6-month progression-free survival rate of 89% is exciting. No new safety signals suggesting that the combination can be used without unacceptable adverse events to patients being treated with this regimen. So adding to the literature saying combination approaches are safe and there may be utility. Another trial, GOG-9923, looked at veliparib with an intraperitoneal chemotherapy regimen and again suggested that this regimen could be administered safely, that there were no concerning signals in the patients enrolled and treated on trial to date. But again, we can't make any inferences about therapeutic advantages or benefit based on the data that was released with these abstracts. This is more information about safety. The future of the care of patients with advanced stage ovarian cancer is incredibly exciting. This is a very dynamic time, and part of this effort to improve outcomes in patients with advanced stage ovarian cancer is the exploration of novel combinations. Right now, we have multiple trials that are being conducted in parallel, trying to look at the advantage of combining immunotherapy, specifically immune checkpoint inhibitors, with PARP inhibitors to try to augment response, take tumors that may not be historically immunogenic or respond to immunotherapy, and try to convert them into what we would call hot tumors. So take a tumor from being cold, not responsive to immunotherapy, to hot, responsive to immunotherapy by looking at these novel combinations. And there are multiple current active clinical trials that are either enrolling or have recently completed accrual for which data is not yet mature and has not been released. A couple of these trials that will be important to discuss. The first is the Imagine50 study, which looked at atezolizumab, an anti-PD-L1 plus bevacizumab. And that was a study that essentially tried to explore whether or not chemotherapy and the addition of immune checkpoint with anti-angiogenic therapy would lead to an improved oncologic outcome. That study has completed accrual, although again, the outcome data is not yet mature, and we don't know if there would be a benefit to the combinatorial approach of immune checkpoint inhibition with anti-angiogenesis therapy. This is really based on previous preclinical data, as well as some of the data from the renal cancer arena. In parallel, the ATHENA trial was looking at rucaparib with the immune checkpoint inhibitor nivolumab. And again, this is in patients who had systemic therapy for primary disease, who would then receive randomization to one of 4 arms. The question being whether or not the combination of rucaparib plus nivolumab led to an improvement in response rates and oncologic outcomes, again, trying to capitalize on the addition of PARP inhibition to try to sensitize the tumor to the immune checkpoint inhibitor. We know that immune checkpoint inhibitors alone so far in ovary cancers, the data has not been promising. The JAVELIN Ovarian 100, where data was once again released at the SGO 2020 virtual meeting, suggested that the hazard ratio with avelumab and maintenance avelumab was 1.43. So our hope is that moving beyond just checkpoint inhibitor with chemotherapy and looking at these novel combinations will lead to better outcomes. And these are not the only trials. There's an additional trial in the Frontline looking at pembrolizumab in conjunction with olaparib. There is the DUO-O trial, which is again looking at a combinatorial approach with olaparib and immune checkpoint inhibitors in patients with advanced stage ovarian cancer. And essentially this body of clinical trials has the intent to try to determine whether or not we can truly identify a patient population who is going to benefit from these approaches and bringing these drugs together. Now, I would like to point out that JAVELIN Ovarian 100, the translational data that's going to emerge from that trial as we try to understand who may have responded and why, is going to be important in informing future studies and the design of subsequent trials in these patient populations.